I think that what PNHP was created to do was to create those bridges to the unions and locally and other human rights organizations that have made healthcare a focus of their work. So that's what we hope to do, and we could do a better job of outreaching to those these organizations. But I think you make a really good point. Yeah, I mean, we have so much work to do, and healthcare is just one small part of it. I think something that we could try to do in 2010, and just your thoughts made me, which is to really link the health insurers to Wall Street. They are Wall Street, and it's their demands for profits that why community hospitals are closing. 3 have closed in Queens in last year, and now you pretty much have, what's that do to someone who's infirm and has to go to Manhattan to get to see their specialist now that they can't see them? So we really should link Wall Street and the greed and the insurers. I think if we do that, my thought is we need to make people hate insurers more than they hate big government, because that's the dynamic there is people really fear big government, but they don't realize. I mean, how many times do we see these teabaggers stand up and say, "You better not touch I don't want the government hands off. Get the government's hands off my Medicare." People don't even realize that Medicare is a government program, but they do hate their insurers. But we need to explain to them.
Can we stop calling them teabaggers?
Well, that's what they call themselves,
no,
but
it's not. They're tea partiers.
Well, they actually did use the word teabag until they found that there was a double entendre there. So it's just a bad habit of mine, I guess. But the Tea Partiers, the people who are kind of disaffected Republicans, we really could join up with them. Is we really push the fact that insureds is corporate-run healthcare. Who wants corporate-run healthcare? I think that's a little more scary than government-run healthcare, given that people over 65 experience government-run healthcare and rather enjoy it.
The fact is, a large part of our population, and we cannot ignore this, distrust government, and they often have good reasons for doing that. And so part of this whole struggle is to move toward we are the government.
Sir?
I've heard very good discussions and questions tonight about the single-payer system and how to achieve it. One woman from Long Island was speaking about people being upset about being taxed heavily for this type of a program. Let me remind you, there are billions upon billions of dollars which can be used for domestic purposes. We must connect the dots. There is a national war program now in existence where billions of dollars are being spent for that war and to kill people, while people are being deprived of domestic services in this country. The peace movement and the single-payer movement are intricately connected. One cannot achieve one thing without achieving the other. And I think it's vitally important that those of us here keep in our heads, in the back of our minds, this connection of the dots, because they are so closely connected.
Thank you.
Last question.
Yeah, I just want to chime in what has just been said about broadening the context and the analysis of which single payer is only a small part. We live in a period of economic crisis, of capitalist crisis. Haven't heard the name or the word capitalism. We are faced not only with opposition by insurance companies, but a united front of all corporate capital, the drug companies. You've got the employer class, who are always complaining that costs are too high, and you can tell them from today until doomsday that you can lower costs. This is a class issue. There's no recognition of that, or I don't see sufficient recognition to assume that a campaign reform is in some way the key to changing the Democratic Party or to change politics. I think is to deny the reality of class power. And that's what's missing here, a recognition of that and how you build a movement which takes into account the necessity of countering the power of the capitalist class.
I don't know if anyone saw Capitalism Love Story by Michael Moore, but he does touch on the fact that we, the people, do have, in fact have power. There was a memo apparently that was leaked, a corporate memo, I think it was from one bank to another bank, I can't remember exactly, but the idea was that the person writing this memo was tried very hard to drive home the horrendous consequences of, for the corporations if the people got together and decided that that was not the right thing, that was not the thing they wanted. So the corporations themselves see that could be a problem. So, yeah.
Which is why they
God
funded
forbid.
the party movement.
What?
I'd like to
Why they
ask
have
Donna
funded
if she
it.
has last words, and ask the panel if they have last words.
Donna,
Yes,
did you hear that?
yeah, I did.
Okay. Then you go first.
Well, I want to say one thing that I heard, the connecting of the dots and the making social movements move together, and I would be really remiss if I didn't mention that I am also one of the national co-chairs of the Healthcare Not Warfare campaign of Progressive Democrats of America, where we definitely connect the dots on the two issues of healthcare and warfare, and have done so for quite a while, and I couldn't agree more. That's something we just simply have to do. We've got to make people understand, and you saw Tony Benn speak in Sicko, if you saw that interview that I thought was so inspiring, where he said, the British learned long ago, if you've got the money to kill people, then you've got the money to help people, and it's just that simple. And we can do that. We can do that as a nation. We can make that happen. In terms of class warfare, that's here to stay for a while, I think. I think we're going to, for myself, I think I'm going to fight the Medicare for All battle as cleanly as I possibly can in the months and years going forward, and try and convince those who feel like they will somehow have a diminishment of their medical care that that's not at all true. In fact, there's every reason to believe that your medical care will get better under a Medicare for All system, and you'll do so, and you'll have more money in your pocket rather than less. I think those are the keys to convincing people in this country that this is the way to go, is that we can do this and you'll end up with more money for your family, better health care, a better quality of life. People like those ideas, and we need to sell that idea to them in a way that they believe and trust and know. And I often pitch in my comments, too, about the government. We're lucky in this country. The government still is us. Like it or not, Max Baucus is one of us. And we just have to elect people who are more like the majority of us than they are like Max Baucus. So I thank you so much for allowing me to speak this evening, and to do so remotely. I so wish I was there. There's so many of you I wish I could embrace and hug, and thank you.
Let me just say, Donna, you can't see us, this is only fine, but this room tonight has only standing room only. I mean, people are sitting all around. They are wanting to hear you, and really do miss that you've joined us, but I think it's been very effective to have you actually on the phone as well. So, and let me just say to the rest of the panel, why don't we put our hands together? This has been a wonderful